And I want to welcome you all to our session today, The Tech Business of Health, Transformational Solutions for Large Institutions, Mid-sized Companies, and Startups. So how many of you here are in the healthcare industry right now? No. So we're all experiencing huge, rapid change with healthcare reform. And for those of you in the healthcare industry, you know that we're not really known for embracing huge, rapid change. So we have a lot going on. But today we want to talk a little bit about some of the opportunities with that change. There's new payment models, new technology has come on board, and we've also seen the rise of the empowered consumer. Today we're going to talk a little bit about some of the transformational solutions that have emerged with this. We'll talk a little bit about the opportunities and collaborations that people may tap into with this. And we'll also talk about some of the pain points associated with working in the healthcare industry. So to get started, I'm going to have our panelists just go down the line and introduce themselves.
Hi, I'm Shan Fowler. I'm the Director of Product Management for Benefit Focus. Here in Charleston, we're out on Daniel Island. We're a cloud-based software solution in the health and benefits space. We do health enrollment and administration platforms. If you've heard about private exchanges, we're heavy into that business. Probably one of the leading companies, if not the leading company, providing private exchange platforms and also tying into public exchanges as well.
Hey guys, my name is Ryan Adams. So I am a senior director at Premier. So I work on a lot of our foundational data technologies. Premier is a $4 billion company with about 3,400 hospitals across the country. We capture 1 in 3 patient discharges, so a ton of data flows through Premier. I came to Premier through the acquisition of a company I was a partner in called Medius. Medius was an integration company. We grew that company to about 330 hospitals before it was then acquired by Premier. I'm very excited about what's going on in healthcare, the disruption that's occurring, and a topic I'm particularly passionate about is data liberation.
Hello, my name is Alan Byerly. I am founder and CEO of GroupHub. GroupHub provides independent insurance brokers with an online benefits platform that is secure, automates enrollment, and is compliant with the laws. So before joining GroupHub, I was a systems architect that did integration and automation solutions for enterprises. What excites me about this market and what we're passionate about at our company is providing quality health insurance to individuals and helping and empowering them to make the most of those benefits. So, that's what I have to say.
Hi everyone, my name is Brent Anthony. I'm a connector and care hacker. Work for 2 companies, Brasco, which is a creative design and marketing firm in downtown Raleigh in the creative district. Also have a second sister firm called Cracked Image that looks at online presence for medical professionals, SaaS-based software subscription model. On this panel, we'll be taking the position of the consumer, patient caregiver. I've had 2 very impactful medical experiences within my family. My grandfather had a rare cancer disease and passed away, as well as 2 years later. My first son had a grade 4 traumatic brain injury, and he is walking, talking, and the passion behind why I advocate for those folks, as well as see through the prism of his eyes when looking at user experience and branding.
Thank you, everyone. We're going to kick off with Ryan. When we were talking about this panel, Ryan, you were telling us about the most underutilized player in healthcare delivery today. That's the patient. And you said something really cool about the rise of the empowered patient and a patient quarterbacking their care. Can you talk to us a little bit about that?
Yeah, so I'm a big believer in that trend. I think it's going to be transformative within healthcare. And if you just kind of look at healthcare and where we've come from, sort of the traditional medical industry, it's very paternalistic, right? It's kind of the doctor knows best type mentality. But in an era where we have social media, crowd-based knowledge, when patients are equipped with Google that can scan, medical journals, more medical journals than any single physician has ever read, right? Does that model still hold true? And I think the answer to that question is no. Patients have a lot of assets. We talk about underutilization. So, I as a patient, you as a patient, you know the most about yourself, more than any physician, for example. You ideally care the most about your health. And now you're equipped with all of this data, consumer health devices, diagnostics at home. So it's kind of a Copernican shift with respect to what's going on in healthcare. And so you asked about some of the trends, patient enablement trends. So providers see this, right? So though many in the medical community, I think, are resistant, right? They're used to old ways, they still see this. And so they're stepping into patient enablement, I think rather slowly, but they are stepping into it. So providers, for example, when I say providers, I'm talking about hospitals, many have set up, or they're starting to set up population health management teams, care coordination type teams. And basically patient enablement to them, for the more advanced hospitals today, means they identify a cohort, they identify a cohort, a group of, say, chronic cases that require additional care that are more expensive. They identify gaps in cares, and then patient enablement for them is outreach. So they'll have nurses call the patient's house, get them into appointments, for example. They might even have robocalling, some automation beyond that. There's a company called Fitel that was just purchased by IBM that's in that business of automating some of that. That's the extent to which they've come as far as patient engagement, right? It doesn't go much beyond that. And that's where I think there's so much potential. How else can providers involve patients in their own healthcare? And so that's a really exciting space right now. I think a lot of opportunity in the future. But I will say, even from a provider perspective, they're thinking about this in still the traditional model of doctor knows best, doctor is right. Doctor is the gatekeeper for the information. I'm more excited personally on the patient engagement side to see what disruptive companies are doing, not from old healthcare, from old providers, but when they base their entire company on patient enablement, what kind of solutions can they bring to bear? So an example of this is Oscar Health. It's a health insurance provider. How many of you guys have heard of Oscar? So it is a startup, and probably beyond startup at this phase. They just got another $140 billion injection based in New York, and they're going about health insurance in a completely different way. So, for example, every member in the Oscar plan gets a personal tracking watch, fitness tracking watch. And if they track all of their steps, they track their personal fitness metrics for a year, they receive a $240 discount, right, from Oscar. So that, to me, is true patient engagement. That's a company who's built patient engagement into their platform from the outset. And that, I think, is the most exciting area of disruption that's going to be taking place.
Thank you. So people that might be interested in tapping into this industry, of course, people that are already involved understand there's a lot of compliance issues associated with healthcare that you don't find in a lot of other industries. Ellen, can you talk to us a little bit about that? If somebody wants to maybe create a startup for healthcare, what compliance HIPAA issues people are facing, and what consequences can we have if we don't comply?
Sure. So compliance is probably the number one barrier to entry for startups. I think that you need to take it very seriously, and you need to spend your time understanding what is required of you. And there are two rules that matter. There's the privacy rule and the security rule. So what we want to be able to do is make sure that we can ensure your privacy and also do security. More importantly, the great thing about compliance, or HIPAA compliance specifically, is, as I was talking to someone earlier, is the portability of it. So a lot of what we're engaged in and talking about today is the idea that we can actually make all of your information and your data portable. And so you can connect it in ways that you haven't been able to do. So there's a great opportunity out there. So startups have a lot of opportunities there to do a lot of great things. On the liability side, there is financial risk associated with liability, and it varies. It really depends on the level of due diligence that you do to be compliant more than anything else. But the greatest liability, and I think we've seen this with Anthem, is trust. So the highest liability risk for a startup is maintaining that trust, especially in healthcare. You're messing with people's data and people's personal data that's always been traditionally very private. So if you don't do that and you get in a situation where you have a breach, then your greatest risk, I believe, is a loss of trust from your customers and your potential customers, as well as the public abroad.
Thank you. Shan, when we look at healthcare reform, the most massive change was with the benefits landscape and that benefit focus. You guys are really on the forefront of that. Can you tell us about some of the opportunities and new solutions available with benefits?
Sure, yeah. So I think that what the Affordable Care Act did, as you said, and I've heard a number of people say, actually I heard Deepak Chopra of all people say that healthcare reform wasn't healthcare reform, it was health insurance reform. It really is, the way that it came about was that they had to sort of paint a villain, and health insurance companies became that villain. Now what's interesting is that with the King versus Burwell Supreme Court, not decision yet, the court case, you see that some of the strongest proponents of not having King versus Burwell overturn the subsidies on the state exchanges are the health insurance companies, because they've taken such great stride, or they've poured billions of dollars into compliance, everything that you talked about, and new delivery systems and so forth. So some of the innovations that we're seeing from that are really things that have to do with payment and quantity versus quality, so shifting to quality. So everything that Ryan talked about with getting closer to the patient, being able to use more data. These are things that are kind of pushing the needle in the benefit space, because really the reality in the United States is that you have insurance or benefits that are sitting between you and your providers. And in many cases, one of the biggest trends, and it feels weird to say that because it's been going on for a decade now, but as we know in this business, we measure trends in decades, not in years, is high deductible health plans. And so with high deductible health plans, you have a much larger deductible. You're paying your money out of pocket. And in some ways, if you can afford it, that gives you a relative amount of freedom. But it also makes you very focused on cost, things that you may have done before with a PPO, going anywhere, getting, you sneeze and you go to the doctor. That no longer is feasible. So the changes that you're seeing are really addressing that. And it's really exciting to see companies like Oscar come in and think about the health insurance and the benefits in a much less fee-for-service way, and a much more kind of day in, day out. It's about health, not about risk aversion, basically. So a lot of really interesting stuff going on.
I think the big theme that we keep hearing is this new access to personal data and patient data. And Brent, that's something you've talked a lot about, is all the business opportunities now as more and more data becomes available. But Brent, you said something very cool. Like you said, he's had a lot of personal experience with the healthcare industry. You said empathy through design. So talk to us a little bit about access to patient data, but also just kind of having that personal touch.
So I think going back to Ryan's point around patient enablement, and you can talk about Oscar as one example there, but also looking at empathy when approaching a client that we're considering the patient and caregiver, and even, there's 100+ caregivers in the United States right now, obviously growing. And I'm not just talking about the elderly scenario, the parent caring for the grandparent situation, but I'm talking about if I'm living in downtown Raleigh, and as I mentioned, my grandfather who was living in Maryland, And then my son is ill. And if I'm not at the table for that B2B or B2C solution opportunity around how to design that approach, as Ryan mentioned, around patient enablement, I was wanting and seeking in the hallway of UNC Children's right care, right time. If my son is about to get a shunt or potentially a shunt, I'm calling up my MBA friend just because I had that opportunity. Most individuals in real America, not in downtown Raleigh and quote the city of medicine in the Mecca of Duke, UNC, and others, that if I sought care there, it was going to be $3,500 for an MRI. Versus I travel 50 miles and go to Greensboro, it's $800. That's what Blue Cross Blue Shield of North Carolina has put out in terms of price transparency. Now, again, we don't have time today to get into charges and true costs, but that's just a couple of ways that I'm looking and breaking down problems at Brasco and consulting with clients on how to keep that patient and caregiver at the table, as well as look at other emerging technologies that could help tap and not have just a one-size-fit-all approach or go with the big box. Because there's situations that there are opportunities out there in the care coordination world, and let's be honest, technology needs help. I come agnostic to you first and foremost. Yes, I can talk all day long about emerging future technologies, but I don't understand the problem as well as understand that the majority of my care is seen in the community, not behind the four walls. And I've had 15 plus years of healthcare system experience. So that's how I'm going about approaching business problems, and I'm pretty passionate about it.
This is for the group. What transformational solutions do you feel like payers are looking for, providers are looking for? What opportunities do you think are out there for startups to kind of tackle some of these problems?
Well, one that comes to mind is certainly, taking like end-to-end solutions, specifically like within, say, physician credentialing. If you go through that process, whether it's managing kind of the statewide regulation or just the institution of, say, a large healthcare system, that you have to go throughout those divisions of the department and try to figure out, where's the quality data, where's continued medical education, CME information that's needed. All of these credentials, could be resided in solution, as well as I've interacted and brokered opportunities where looking around bridging the patient and caregiver and going beyond the walls. There's a company out of Boston called Verbal Care that has a slick user interface and certainly going beyond whether I need private therapy or I interact with early intervention in the state of North Carolina for child development. So this is, if you don't have your health, how can you talk education and other opportunities? But these are cross-cutting applications.
Just to add to that, I think that and you mentioned it, technology needs help, but I think in addition to that, the industry needs help understanding technology. So there are things where that I think actually get you to, if not necessarily a closer patient relationship, a more timely patient relationship. Things like telemedicine. So, and there's this thought that, this sort of, conventional wisdom, well, if you're not sitting at the doctor's office, then can it really be any good? And the truth is it's really good, even when you go to a doctor's office, they barely look at you. And so getting closer to a patient doesn't necessarily have to mean getting physically closer to the patient. It can mean using enabling technologies to lead to better outcomes and better decisions.
So as far as opportunities go, I really think that each of us would agree that it comes down to that data and that data connectivity. So for startups like our startup, it really is amazing how many companies, both large and small, are out there trying to take over or take on significant portions of this problem. It is a wicked problem to try to connect all of our data and our information and present it to people in a way that they understand it and can be empowered by it. So when you are passionate, as he is, and as we all on this panel are, about solving some problem that touches you personally, there's a massive opportunity for entrepreneurs to take advantage of that. One way specifically that we are tackling it is to use our technology and our platform to empower underserved populations to get access to healthcare. That's something that wasn't possible before, especially if they're in rural areas, remote areas, such as Native American populations. Being able to take that technology to them and present it to them in a simple way and connect them to their providers, to help them find providers that they wouldn't have normally had access to. So, for example, say you want to have, you find out you have a benefit such as nutrition, and you want to be able to find a nutritionist. To easily be able to do that and to get your information to them in the blink of an eye is something that's exciting, and is just one example of many that where entrepreneurs can be empowered to really make a difference.
Yeah, so I agree with a lot of these comments. I think it's fantastic, especially I would echo what Shan said about telemedicine. I guess coming from a provider perspective, so Premier, as I mentioned, is 3,400 providers across the country, so we work with hospitals every day, and we are very interested in what healthcare technology products hospitals are buying, right? Because if they're buying something and it's from a startup or an early stage company, we want to either sell the product as a reseller, we want to invest in the company, or we want to acquire it. So I guess from a provider perspective, in terms of what are providers buying now, I've got probably two specific things that providers are buying completely, very hot market segments, and then one general thing I'd say about that. The first specific item is data analytics, right? So that's a very wide category, but I would say big data type problems. So providers have invested in electronic medical records. It's been very successful. So we've moved from paper-based to digital, so we're there. Now, how do we make sense of all of this data? How do we take the clinical data, marry that with the claims data, marry that with supply chain cost data, and be able to run analytics on who are the most costly patients in my health system? How do we take some sort of proactive intervention? So big data analytics is huge, and providers are buying that right now. The second thing I would say is population health solutions. So that's sort of a nascent type of market, but that's growing as well. And I think patient enablement will play a big role in that. But here's what I would say as well, and this is again going back to transformation that we're seeing and kind of the shift in healthcare. So here's the big thing you need to know about providers if you're a startup and you're looking at solutions and you want to sell something to hospitals, is there has been a massive shift in what providers actually are. So they're moving from organizations that generated revenue to cost centers, right? So that's a huge transformation. Remember, fee-for-service is all about you come to the hospital and you stay a night, we charge you a fee. But in a world of pay-for-value, that becomes sort of a cost. And we want to keep you out of the hospital because that's more expensive. We want to take intervention while you're in a less costly location like the home, telemedicine, as Shannon was mentioning. So here's the category. The general category is this. Anything that saves hospital organizations and providers money is something that they're willing to buy. That's pretty broad, but that's where you should focus.
Here's the flip side of that, and here's where startups in particular are scaring the crap out of large companies. If this is seen as a cost savings, and if it's something that can be instituted within your organization, then it's great. But if somebody else is doing it to you, then it freaks you out. Your business model starts to collapse. So in our business, what we've seen, the way that we've seen that is the people who stand between even the companies who provide insurance for their employees and the insurance companies and their providers are the brokers. And there's this company out of Silicon Valley called Zenefits that's doing a lot in this space. And they've actually been outlawed in a couple of states. My home state of Utah outlawed them because they were seen as a job killer. You know, you can't be a job killer in this political climate. But really, they were not a job killer, and they ended up being reinstated so they could do business in Utah. But that kind of thing, and you see the same thing with Uber. You see the same thing with Tesla. Tesla has freaked out car dealers, and you know, I don't know if there are any car dealers in the audience, but it might be good to be freaked out a little bit. But you got to really look at this and see, you know, you got to move fast, and we're not a business that moves fast.
But I also think, you know, the patient is not going to wait. And so we have options. And so, yes, we need to move fast as well. And so I was in an excellent panel discussion yesterday, listening to graphic artists, engineers in the art world and animation, and how they are connecting with various disciplines in the community. We reside in a community, whether it's online or offline. And that's kind of what we're looking at with Cracked Image in terms of what I do offline. I also, if I'm looking for that dentist in a 3-mile radius, I'm Dr. Googling it to try to find it. Or I'm going to Facebook and saying, oh, well, hey, my wife said to check this out, and here's, you know, the options. Then I want to know more about that. You know, Google has just placed out on, you know, their top search is always, you know, healthcare diseases or symptoms. And so it's not always the disease, but all the symptoms. So my son has some movement disorders that are looking at, you know, his head and neck situation. But I'm still trying to figure out, where do I go and seek that information if I've got, you know, 9 different patient portals? Do I have time? As well as if the government's providing my lab results to me now, well, that's great for me. I mean, I'm sitting here with some education and as well as I've felt it emotionally, socially, and financially for multiple years. And thank goodness I have the community around me, but at the same time, others do not have that choice or opportunity. So I ask that, you know, think about health literacy. Think about patient education. Think about designing it in a do-it-yourself or an environment that brings it to you and your community, whether it's, you know, obesityhelp.com, if it's an obesity type application. Figure out what they're talking about in those communities, as well as that's where the doctor should be potentially, or the provider should be leading that opportunity and that conversation in a proactive manner. There's a huge opportunity there, folks.
So I just wanted to address the benefits play that was brought up. It's because our business is about brokers. So we empower brokers to be able to compete against companies like Zenefits. So we find opportunity, even with these disruptive technology companies that just started, as a way for us to actually empower people and to do things just like what he said, to connect people to their data in a platform agnostic way. So they don't have to go to 10 portals. They go to one portal, access all of it, and be able to use it in a way that's empowering. We're finding incredible success with insurance brokers that want to say, yes, we want to deliver that to our customers. It gives us a competitive advantage. And the advantage of doing something like that is insurance brokers are concerned they're going to be replaced in the marketplace. We see insurance brokers as our partners because they have tons of experience and tons of expertise in customer support and customer interaction, where they can empower employers and feel the needs of those employers and all of their employees in a way that we really can't do. That personal connection to people is a necessity. And I think even for the larger businesses that are out there, thinking about ways that they can partner with and use the transformational technology that's coming out of startups to empower themselves in a partnership sort of situation, there's great opportunity for both of us. And it doesn't have to be a scary environment, that it can actually be one that's actually really exciting and vibrant.
What roadblocks have you all faced as new startups and entrepreneurs, and you know, what advice would you give to people trying to break into this?
You know, I guess as far as advice, right? So if you're a new startup, you're looking to launch, you're looking to do something. I guess to me, you have to start with the question of what do you want in healthcare? Like, what are you trying to build? So you could be trying to build sort of a lifestyle type business, right? Maybe make an exit, or you could be sort of going for gold, right? So I guess my advice would be if you're trying to start a lifestyle business, right, and trying to kind of grow the company to a certain size and you're selling to providers, here's my advice. Do not underestimate the sales cycle, right, to hospitals, because it is ridiculously long. I mean, you're talking about like 12 months, 16 months, 18 months, if you're lucky, then maybe you'll get a pilot, and you'll be in this purgatory pilot hell for a period of time, and then maybe you'll land the account. So, I see entrepreneurs with great solutions, very vibrant products, but they can't figure out distribution. One of the things that our company's Medis was very successful in was establishing channel partners, right? So there are a lot of companies out there who have trouble with innovation, building product, but they have great access to hospital systems, and they're clamoring. They just need product to sell into their channels. So find partners, establish those partners early. That would be my advice. But let's say, like, you're going for gold, all right? So here's, a bit of advice from John Doerr. He says, screw incrementalism, right? Like, don't think about the small problems. There's a lot of areas on the edges of healthcare you can cut off and create sort of a profitable business, maybe exit it. But think about something big, right? Like, this industry is poised for disruption. There's so much waste. At $2.8 trillion. We as individuals in the U.S., it costs us $9,000 per year in healthcare costs. So, think about something big, right? It goes back to what Shan was saying, right? So we take Uber, and this is a quote from Jeff, who's former CEO of Medis, is in the audience today. But the largest retailer doesn't have any retail shops. That's Amazon, right? The largest taxi company doesn't have any cars or drivers. That's Uber, right? Who is going to be the largest healthcare provider that has no doctors, right? That's an idea. Go run with it. Be disruptive. That would be my advice.
So, yeah, I think that's great, although I'm going to disagree with one thing. The largest retailer is Walmart. They have more real estate holdings. They have more value in real estate holdings than Amazon has as a whole company. So brick and mortar is still important. Hospitals are still important. But the real barrier here is the combination of everything, the compliance, the administrative burden. So it's like you have this pot of gold, and between you and the pot of gold is a moat with alligators, and a prison fence, and a brick wall, and I don't know, like the American Gladiators obstacle course. You have to have perseverance, and things don't happen fast in this industry. And the biggest technology companies, Google Health and Microsoft Health Vault, tens of millions, hundreds of millions of dollars put into that, and they underestimated the problem. They thought it was a technology solution that was needed, but it was much more than a technology solution. So when you're looking at it, don't underestimate the nuances of compliance. Don't underestimate the nuances of networks, personal relationship networks. Don't underestimate brokers and different people who play a part in the industry, because it'll come back to hit you. Going back to this, case with Zenefits, their CEO has come out and said brokers are lazy and stupid and they don't need my money. And then, lo and behold, the way that they got back into Utah was that they made inroads with brokers. So you have to sort of, eat your dog food and just get out there and keep going, because otherwise it will crush you.
I certainly agree with the discussion here. For me, looking at opportunities that can coalesce around situations, particular within care coordination, and going back to Ryan's point around population health or the medical home model, and specifically looking at the analytics of those type of applications. And so my advice would be, find those doctors that are out there, right, and willing to sit down with you, talk to them about their workflow, what their pain points are. But also invite those folks that are the patients and caregivers within their shop. Those are a lot easier to penetrate the 12-month sales cycle that you continue to look at in terms of the channel partner with the hospital. Also looking at the network effect of not only healthcare, but like Instacart, or looking at how Maersk in Scandinavia, their biggest barrier or competitor, they thought, and was Amazon. And so Maersk is a shipping industry leader and one of the ripest innovation hub in the world, if not in Scandinavia. So that would be my advice, and certainly happy to take questions.
So, Alan, do you have some tips for?
Number one, don't do it. No, just kidding. So it's interesting. I'm on this panel, and I am the target of that question because we've been around for 9 months now. And so two things that I would give as advice. Number one, listen to the people that have already been in this market space, both people that have been here traditionally and people like the people on the panel here. So I'm listening attentively to what they have to say as advice. But number two, and probably most important, is bring something that you're passionate about and that personally affects you to your business. I know my co-founder and I both got started in this particular business because we both faced a health crisis and struggled with health insurance. So at the end of the day, we have a lot of struggles. We have a lot of problems figuring out who our target customer is, figuring out how we're going to work in this marketplace, how to deal with compliance, and it's a lot of work. But at the end of the day, we look back to what we're in here to do, and that is to ensure people get access to quality health insurance and are empowered by it.
Thank you. We do have a few minutes left to take some questions. Right here.
So this is going to make this big one. This is everything that I've been in the healthcare space for about 8 years, mainly the medical device side. What we found was the largest barrier for innovation for doctors. I was in school for 10 years, and I walked in the office with this invention, and they're saying, well, how does it change this? So we looked at it as an obstacle. There's also been credit companies that have accumulated anecdotal data just through user input that as this group population increased, the outcomes became a little more statistically significant. So I'm part of a startup right now that is mainly in mental health. It's accumulation of behavioral symptoms and management there. And our objective is to eliminate some of the steps in treating mental health. Do you have any ideas or concepts for barriers outside of the actual provider itself, and as well as the reliability of the factors that use?
So overcoming
Overcoming
the obstacles, yeah.
the doctor as well as
I would say, and we're not in that specific space, so take this with a grain of salt, but I would say try to go straight to the end user. There's a company, or a, I don't even know if you would call it a company or movement, Patients Like Me, that was kind of founded, getting back to the passion, it was kind of founded out of some brothers whose other brother had ALS, and they weren't getting they weren't satisfied with what doctors were telling them and the clinical trials and all that. So they started Patients Like Me, and it was really a user community where you could come in and track on a daily basis how drugs were working for you and that kind of thing. I have to admit I haven't followed on for a number of years, but I do remember that they actually had companies starting to come to them, pharmaceutical companies, hospital groups that saw this group as like a great clinical trial for them, and was kind of working around the FDA guidelines and these kinds of things to provide this social graph or the social data. So if it's possible for you to go straight to users and build a community, that might help.
I'm Denise Gosnell, data scientist for PocketDoc. And Alan, I heard you mention a few times how important it is for you to really drive your vision with data analytics. And so I was curious to hear what you see as being a really strong component for your future business model and what the data can tell you for what you all are working on.
That's a great question. So there's a bunch of different things. In fact, I'm kind of like an idea guy, and my co-founders and everything will tell you that I can sometimes get lost in too many ideas. But just to give you a few that we've already worked with is not only just connecting you to payer information, but also allowing you to do such things that we talked about, self-service, self-empowerment. So things like you can do manage your own claims, your own eligibility for a specific treatment on the fly in real time, being able to get your claim status, be able to do doctor referrals, be able to find your doctor that matches your health insurance plan. On the other flip side of it, by connecting it to additional data, there is such things as we can really be empowering people to connect to their wearables, and then also to do analytics around that. So you've got a claim, you're on a particular medication, and then connecting it to your wearable and health data to actually see and track how your progress and success over time with the different, not just wearables, but health apps. So there's a lot of different options that you can do with connecting data, and those are only just a handful of examples.
Thank you.
I think to follow up on that same point, if you take my son's case, had a feeding tube, obviously the wearable, I was commuting back and forth, 20, 25 miles each way, just to do weight checks, as well as having alerts. So then that could be easily uploaded, as well as I can't tell you how much time was wasted, either lost income or productivity opportunities that I could be doing in a better and more efficient way. So think about peace of mind, think about time in types of solutions that he just mentioned in terms of eligibility, claim reference, and then, packaging that in a way that is like Instacart or, one of these other type of examples that was maybe non-healthcare or, does that answer?
It does, thank you.
And I'm sorry, we're actually out of time. However, the panel will be available. I know we have a couple other questions, and you can come up and talk to them. Thank you so much, and enjoy the rest of your week.